Today is Wednesday, February 21st, 2018. This is Hannah Crawford for the GPI History Project, and I'm with Dr. Elias Durry in the broadcast studios of the U.S. Centers for Disease Control and Prevention in Atlanta, Georgia. Mr. Todd Jordan is our studio engineer and videographer, and this is our second interview. Last time we spoke about Yemen and your early career and what brought you into public health and work in Africa. And this time we are going to focus on Somalia and South Sudan. So during the period between August of 1999
1999, exactly.
and July of 2006, when you were coordinator in the Horn of Africa for EPI and polio eradication.
That's correct.
Great. So thank you for coming back. And I guess to open up, maybe it makes sense to sift through your memory of the transition from Yemen to, did you go directly to Nairobi?
Yes.
Okay.
Thank you very much of having me again, and I hope I can give you whatever I remember. I think, when I was in Yemen, I was supposed to be there for 4 years, and I left in 3 years, and not because of anything, but we knew that the work in Yemen was done, so we were ready for the next challenge. And the next challenge was clearly these two countries, including other Horn of Africa countries like Djibouti, i.e. Somalia and South Sudan mainly. And we wanted just to go ahead and start the work there, in earnest. Although there were some activities before me, but we knew that these two countries would be a big challenge. So rather than sitting and spending that extra 1 year without much of excitement in Yemen, I decided, and my colleagues here also agreed that I should move to Nairobi to coordinate the Horn of Africa activities for the Eastern Mediterranean region, which is South Sudan, and Somalia and Djibouti. And these are very two unique and important countries. First, because there have been a lot of outbreaks, especially in Somalia before. But Sudan was also going through major famine and other wars, and other things where really there was no government. I think the commonality of these two countries were that in both places there was no government. Both places were fully war-torn countries. In Somalia, that was a civil strife where, by that time, I think the country did not have any government for more than 15 or 20 years. Probably today, even still today, Somalia doesn't have a central government, and it was a country that was really, every clan had its own issues, and there was such inter-clan fighting that there was no place that was safe or any place that any kind of system could be there. Meaning there was no infrastructure, there was no ministry, the infrastructure was there, but there was no ministry. But everything was really run by local clans and basically no system. And the one could say the same thing for South Sudan. So South Sudan, if you remember, it has been fighting the Northern Sudan government for years, and it's a very remote area. When I mean by remote, it is a place where there was no development. All the last of the decades of their life was all just fighting with the Northern Sudanese. And again, there was no infrastructure, there was no central government, and it was going through a bit of a tough time, including famine, and of course the war and the bombardment from the north. So these are two unique places where we have to reach every child in places that there is no way of reaching every child at the same time across the board. So it was really a very interesting challenge which I was really excited about. So I moved there in 1999, and then our aim was really, by then the 2000 deadline for global polio eradication goal could not be achieved, but we were determined to finish it by 2002. And just to summarize, in both places by 2002, all indigenous virus was eradicated, and we achieved that goal, just together, as actually probably better than other countries with peace and infrastructure and with the government structure. So there are, as I said, two unique countries, two different problems, but at the end of the day, there was no system, there was no Minister of Health, there was no government in both places. So we have to first actually, make sure we understand the dynamic of what are those specific problems, and to come up with a system that really kind of cancels whatever is on the field and allow us to work, which we could do.
What did you know when you showed up in 1999?
If we take Somalia, we know the country is in a major, clan war. And I, during my childhood also, I'm not too far away from Somalia, but that's not the issue. But the issue was that the country was really torn apart by clan fight. And then it's not only clan, it goes to sub-clan, sub-clan. So, really to the extent that there is really no actually peace in a sense of having a government as we know it. They were functioning, and there is always a fight, but they had their own way of dealing with their own issues and coming up with infrastructure solution, including telephone companies. But everybody was, because of the really huge war, everybody eventually had to go back to where they come from. The problematic areas were where there were multiple clans who lived there for some time, like the capital city of Mogadishu, where everybody claims that it is theirs. So the bottom line is that Somali is a clan-based society. Whether you look at it 1,000 years ago, or whether you're going to look at it 100 years from now, it's a clan-based society. And their issue is not one clan against the other clan. It's not that my clan is better than you. Their issue is my clan is not less than you. So the reason I'm telling you this is because what we've done is, we knew that we will require human resource across the board from north to south and east to west. And that human resource have to follow that clan structure. If we give any name for any position, and we say this clan, let's say district polio officer. So if one clan has a district polio officer, the other clan also has to have district polio officer. So with that, I think before that, we knew for both countries, both South Sudan and Somalia, because there was no government, for the first time in GPI history, that we have to put a structure that can not replace, but compensate the lack of government. Because there is no ministry, so we had to put a structure like at the national level. We used to call them hubs, different, regions put together, and then districts, regions and districts and so on, all the way down to the villages. And those structures have to be fully supported by us and managed by us. We did that, we had 5 regions, 5 hubs for Somalia and 9 hubs for South Sudan. And these hubs have to be managed as if it is really the center of all of the activities. And through these hubs, we were also able to bring, one thing I also want to tell you is, because of the situation that both countries were in, most of the services, health services and other services was given by UN or NGOs. And, again, because there is no government or anything. So we also had to work very, very closely with these NGOs, like in South Sudan, about 45 NGOs, including major UN agencies such as UNFPA, UNICEF, and all. So what we used to use this hub is really to bring everybody together to work together as one team, not as, this is WHO or this is UNICEF, but as a polio team. In addition to that, because there was no staff from the ministry, we had to put people in the field across the board as our own people that we hire. So in Somalia, for example, we started with about 230 people at one go that will cover all districts. These are not vaccinators. These are permanent polio workers who will manage the districts, as if they are Minister of Health.
And they were from the communities?
They are from
Were
the
they
community.
from the clans? Did each clan have?
Yeah, and we had the same number in South Sudan. It took us like 3 months to hire everybody we need in South Sudan, but it took us like 9 months to hire everybody in Somalia. Because in Somalia, we had to go and discuss what is our aim, what's our goal, what we're going to be doing, and what we need, whether in human resource wise or car rental, what we're going to be needing for the whole year. And we will not move and do anything until and unless we have full agreement with the local community leaders, not the warlords. So we really sat down with each community leaders to come up with, the basic things that we want, which we know, and we can explain to them, okay, we want, one district polio officer, we're going to be doing 10 campaigns. We will be, for each campaign, we need like 6,000 vaccinators. We will need this many cars. So we put it out in advance, and you say, look, you guys go back and figure it out among yourselves, because if you have anything, but we want this thing to happen in this way, and we went ahead and did both in the staffing and activities only once we got the full support from the community, because I don't know if you remember that these clans were led by warlords that were really very vicious, and the ones who just want to serve themselves. And we did not want to be intimidated by these warlords. So what we did was, we tried to, like you say, pick a feather of a bird one by one so that the bird cannot fly. So we really worked very hard with the community. So even if the warlords wanted to come in and impose what they want, we can comfortably say, no, we will not do it. And they know they cannot do anything because the community is with us. And the community is with us, and they never could blame us also that we are supporting the other clan, because we're doing the same thing with the other clan, with the neighboring clan. So really that gave us a very, very strong acceptance by the community. And I think, for example, when I first went, Mogadishu was in the middle of an outbreak. And, with so many NGOs, with so many relief money and stuff, people have their own ways of how they use. And we refused to work in Mogadishu until they accept our way of work. Eventually they had to, because, every other clan was working except them. So we were able to really kind of accept the challenges, but had a very good solution for them, so that we don't get, entangled in the politics and in the fighting. And I think it's really I just came back last week from Nairobi, because we have a circulating polio circulating vaccine drive polio virus. It was so really fulfilling to see those guys are still there. They're holding the torch, and tomorrow, for tomorrow's Ministry of, if there is anything, they will be really the ones who will be at the top, because they are it is the only system across the country. What I mean by that, I'm not talking like having a strong system here and nothing there, but really having cross-cutting infrastructure that goes down all the way down to the community, from east to west, every part of Somalia. So it's really very fulfilling to go back and see that it's still working, and it's still very, very cohesive and doing well.
When you started working with the clans in Somalia, was there a strategy to deciding where you would start? Did you choose specific communities to begin that work and building that support?
You can't even start there piece by piece. If you do it, you put it on the table at the same time for everybody, and it is the same discussion. It is the same behavior that you have to show wherever you go. You can't by the time you come back to the other one, if you start them piece by piece, then you're already in a mess. For example, let's say we rent a car, and we really rent a lot of vehicles, because again, there is no Ministry of Health, there is nothing, so people have to move around during the campaigns. So we go to the community and we say that this is the kind of vehicle that we want, 4-wheel drive, this. We would like to have this many cars by the end of the year, and they will, and we will sign that contract with the community. And if anybody in the middle really comes and has any problem from whom we rented, that's the problem always, because why are you renting from this clan? Why not from my clan, or why? So the warlords, that's how they make money. The warlords, they rent, airfields, they rent cars. So, but now that we're working so much close to the community, if anybody comes, we're not running away like any other UN agencies. We go back where we got shot. Shot at the, not us, but the nationals. And we demand the community leaders who made a deal with us come back and discuss, bring the person who shot at us. And when I mean us, I'm talking about the vaccinators. And they will. They apologize. At the end of the day, we kill 2 goats, and then everything is fine, and take off. So just to show that we were not siding with anybody. But once we make a deal, we make a deal. And then we knew that, the problem with a lot of people is, they think that, it has to be the same. You have to be very careful, even when you drive. When you drive from one clan area to another clan area, even if it is a short distance, you have to stop, get off that car of that clan, and jump into another car of that clan. So we understood all of these things, and that's how we never really had a very serious problem. And we did the job.
How did you know?
That we did the job?
No, how did you know how to go about doing everything? I'm kind of returning to this idea that emerged last time when we talked about just being familiar with culture and with people.
No, but I think, but also is really, okay, we're trying to reach every child. How do we reach every child? It's not reaching every child one time. It's not only twice. We have to reach every child with multiple times. So, how do I do that? And then we have to better understand the dynamics, the political, everything, to say, in some places you may want to use different things. Let's say you are in the northern Pakistan area. There you cannot do that unless you work with the military, because it's really nobody listens to you. But here we knew that, for example, for Somalia, we knew that the fighting, although the fighting was there, the fighting is a clan-based fight. So if you respect that, you know that things will be fine. The problem that the people are still fighting is people, a lot of developmental agencies just don't understand that this is a clan-based society. We say, why don't they have one flag? Okay, one flag, but these people have been nomads for years, and all they know as a part of the last protection is their clan. To them, government and this is really not, it is their clan. The clan is what is so. So, just like I told you in Yemen, so what are the things, that is really holding them back from doing things? How do you use the community? How do you use the clan-based system over there too? Here also is that, but that's only one part. But then the second part is to make sure that you have all the enabling factors to do the job. So, luckily we had a very excellent support both from the regional office, from WHO headquarters, and here from CDC, to really give us or give me whatever we asked after we plan. And then when we plan not to fail. We plan to succeed, and really, I was insisting that whatever we said we need, we get it, and we don't have a discussion about it. But the plan also is not, based on just to say, small increment. But if you want to do this in 2 years, let's do it in 2 years. So for example, for internationals, for example, to go anywhere, you need security clearance from the UN. All right. So when we come in and ask for this major intervention across the country, so to send these international consultants, UN has to give us the go ahead, meaning clear us. But our activity was so huge, they couldn't do that. They can't. So because they couldn't go and assess an area, they say denied. So for the first time, and then I called Geneva and I said, listen, I don't need 9 surveillance officers if they cannot go. So take away the 2 of them, or you can give, but without security officer that will work with us, we can't go anywhere. So, before that, there has never, ever been a security officer assigned to any WHO activity. Even, so as a program. So, so even if there was no precedent about it, for it, but with appropriate justification, we get all of these things. If we need, the number of people that we need, we have it, and we had a very strong autonomy to really run the program the way we see fit. If we need guest houses that need to be built, we have to build it. We will discuss about it later on. So the incremental or kind of slowly, let me see what will happen. It doesn't work like that. So we put in both places all of our energy at one time, and it worked.
How did you estimate time?
Well, for us, at that moment, we say we cannot do this for more than 2 years. 2 years is a good time with good effort to eradicate polio in a country. The eradication part seems simple, but it's really is to make sure that children are immunized quickly, and that could be done in 3 to 4 or 6 months. But then you have to sustain your gains, and whatever is trickles out and in some remote areas, in some nomadic population, that took us 2 years. But in both places, in 2 years, we finished. And that was our goal from the start.
So you said that you received the support that you needed from WHO and CDC. If you were in conversation with another coordinator and you were comparing and contrasting the needs in Somalia and South Sudan, how would those needs be different from other places, and how would they be different?
Anyway, wherever I went, I asked what is required, and I always received it.
What was usually required for you?
No, I mean it is really the system. The system that you need in Somalia is different. For example, in South Sudan, the fact that we can hire as much air flights as we wanted to, because there is no roads and anything like that. I mean, I was not saying, okay, one plane here, one plane there. When we plan to do the activities, so it is how do I reach there? So so it's not how do I reach here, there, but how do I reach all places at the same time? It's not. So my plan is really comprehensive to reach every place at the same time. So when we do campaigns, it is like really a big deal across the country, as if the place is shaking, because we mobilize everything at the same time. And that's the only way you can eradicate, because if you leave some places that are not immunized, it will come back and destroy what you have done. For example, if we could not transport vaccine in South Sudan, because most of the airstrips are, is full of water during the Nile. When we say, okay, we parachute vaccine. They're parachuting food, so why not? So really, we did a couple of times that kind of move. So when we had to reach these children, we make sure that all those children, whether it rains or shines, will be reached, and whatever we need to achieve that, we did it.
I had a chance to speak with Naveed Sadozeh in Geneva, and he spoke about one vaccinator who walked something like 50 kilometers in one day, barefoot. And he described 3-inch thorns. So do you have vaccinator stories?
The South Sudan vaccinators are really okay. South Sudan, as I said, probably at that moment when we were there, beside the fact that it was bombarded, or when we go other places, you have to find a bunker that, because the bombardment from the north was very, very regular. Beside from the war, there was really no infrastructure and no roads. I mean, the road that they say that those women have, it is like, I don't know, 10 kilometers for the whole country or something like that. So the challenge of Sudan is really to go from point A to point B, because really it is just nothing. It's just beautiful land, but there was nothing. So what we used to do was, we used to call, I don't know how we rent this huge planes to go to take all of our materials and drop the vaccines, everything we need, and then it's called happen scoop, and then there are small planes that we send from out of these big airports. But that is also very limited, because you can't cover all places. Then the question is to take that vaccine from that little airfield all the way deep into the villages. Sometimes it takes for vaccinators to walk for 5 days just to take it there. And I don't know if you have heard about cold chain. And what it is there where we really using the vaccine vial monitor, how for how long the vaccine can be effective. We brought something that's called fast chain, because you can't use there's no cold room, there is no refrigerator. So these folks really used to carry these vaccine, big boxes with the vaccine and ice packs for 5 days. And we have shown that yes, you can, but you can't keep opening it. And I don't say it is normal for them, but it was really phenomenal of how that work was done, not by us, but by the people there. And most of the time they have to walk through swamps, and they're really, we have pictures where, people are carrying big cold boxes on their head for 5 days. And the same thing with the surveillance, being able, training every NGO and everybody to say, okay, if you see any paralysis, let us know. And well, okay. Also, we used to work with the opposition army also, not overtly, but we using the radios and during the campaign, the radio rooms are really like cracking from morning to evening. Everything is polio. You have this many children, that many children. So even if you're not doing anything, you can't just be in South Sudan and not know that there is no polio campaign, even in the middle of areas where there were famine.
I'm still interested in going back to systems, the systems that you set up. So you just mentioned surveillance, and that's one of many systems. But could you talk about surveillance, setting up surveillance?
Yeah, surveillance also, these two places taught us, again, I want to repeat the fact that there was no Ministry of Health. There was not a single staff that you may want to see in other countries where there may be this unit, that unit, the surveillance, there was nothing. So and to do those kind of stuff, you can't reproduce ministries, because it's not our role. But we really tried very hard to make sure that the fact that there is no Ministry of Health will not impact us. So we had to come up with both buildings, transportation, human resource, management, leadership. In both places we did it by 230 or 250 national staff, with about 10 or 15 international staff. Each of us doing what we are best at, but relentlessly, just following everything that you do based on the plan that you put, and really making sure that everything we do is that. It is. I see sometimes, it's even with the ministries of life. Probably, the fact that there was no ministry, it probably was a little bit better for us, because we could do what we say. I think that's why some people may say that was a shadow Ministry of Health, because we were the Ministry of Health.
Shout out to Hamid Jaffrey.
We were the Ministry of Health. And
what parts? So you said that your goal was not to reproduce a Ministry of Health. What parts of a Ministry of Health would have dropped away? What parts that might have existed in Ministry of Health did not exist in your system?
Ministry of Health, I think it is essential in a lot of ways. The problem in doing a genuine job everywhere is governance. And when you don't have governance, like that's how we are behind a lot of countries. These Ministry of Health folks sometimes, they may not see what you stand for. They may not see what is really important, but that's their livelihood. And a lot of them would not let things happen or would not do the right thing because of some of I'm not painting everybody like this, but basically we have this problem of governance in every country. Money cut here, money did not go there, So that part of people's greed, is the problem. And when we did it, we had such a full control, meaning it doesn't mean that nobody cheated us. Even our own guys can do the same. But it was, such a strict accountability. And there was no game that people could play to extract from you something. So if thing has to be done, it will be done. Like sometimes, ministries will tell you, oh, no, with this day, we cannot do this campaign. We have this big meeting coming up. So just to drag things and have their own way for things that the way it fits them. But with us, all of the implementation of the plans and everything was according to what we thought is really superly effective. So we were not. I mean, in Somalia, we had a discussion with people like warlords, and one part of Somalia was also, had a kind of a young government, and it was difficult to do work there compared to the places where there was completely no government. So that governance, that interference that comes based on because of governance is a problem. I mean, you wouldn't mind if a government or a ministry has a really comprehensive plan that is well thought of, and they can tell you, okay, your priority may not be our priority, but let's work, But most of the time, it's not that a country has a comprehensive plan, but they just these stuff, and especially in these war-torn countries, people are used to, having a better life out of miseries of others. I can't say everybody is like that, but the fact that we could do what needed to be done, not what we wanted to do, what needed to be done without much interference from whatever institution you call it, whether ministry or government, but that also forced us to work with the community, because you don't have any other choice.
Who are the different stakeholders in the community? What different leaders did you work with? You mentioned warlords. You mentioned other leaders earlier.
Yeah.
Within the clans.
In Somalia, it is again, this clan system also, every community has an elderly person. Every community that has
one.
And they may at least they are at least one or they are in groups, but they are the ones which really maintain the system, that society system. I don't know if you know this, but for example, in Somalia, if you kill someone, you're not responsible. It is your clan that is responsible, and the other clan also may not be just looking for you, but it may be looking for anybody in your clan. So it is not an individual responsibility; it's a clan responsibility. So to maintain that kind of that kind of a system, if somebody does something bad, and someone would at least manage the crisis, you have to have really a very close and respected structure, which what we were working with. we with those many years, we didn't have a lot of bad events, but one time, two of our staff were kidnapped. And it was a big news, but that was because we went in to Mogadishu with a larger UN contingency. Then when they saw us, then we were not those guys who are just neutral to the job. Because, there is a government that international community wants to establish. There are the warlords who don't want to see this. So the UNDP and others are trying to help this, infant government, and then the warlord gets mad. So just to show that this new government cannot sustain itself, what they did, they kidnapped all of UN staff. When the UNDP, head of the UNDP was visiting, that was the only time that happened. Otherwise, because of maintaining this community-based relation, our staff are coming from each and every clan. So,
obvious question would be, how did you deal with that situation?
Which one? The
kidnapping.
Yeah, our staff were the one who helped us to release them. Our staff and their clan. I mean, there was no clan that we did not have a staff, that we didn't have a senior person in that clan.
Do you remember hearing details about how that was worked out?
Yeah, though sometimes I don't want to remember it, but yeah, it had a lot of different pieces because, the people who kidnapped them also sold them to another clan. And they were put into two different places, so two different points of contact. And they were not the only ones, there were other people, but the ones which, and luckily, people, even the ones who have kidnapped them are guys who sometimes work for us as security, and they knew who they were, and they say, "Don't worry, nothing will happen to you." It's real, but luckily at the end, our folks being there and that being, interacting with them, going and visiting them, really, I'm not saying that was the only reason, but really it helped. And that was one of the really tough time that we had in Somalia. I mean, it's a few days, but I think it was our mistake. We should not have gone with that contingency.
It sounds so like such smooth operations. In some ways, the work that you're describing, I wonder about times when it hasn't been quite so smooth, when you've had to really get involved. I mean, you're known for working in tough places. You're known for ensuring safety, working on security issues. Could you talk about some of those experiences?
I mean, you're looking for tough. There was no. I mean, just imagine, because we were able to know trouble before it even come anywhere. So we were never caught in the middle of I mean, if there is something that happens, I mean, I tell you, sometimes I say, one time, I sent Voice of America journalist, and I arranged for her, to meet all 5 warlords. And she was really surprised how we can arrange meeting for 5 warlords. And then in the middle, I told her, get out. Because even before we knew that things would happen, our contact was such a vast contact, and no one wanted us to be harmed. They let us know. So, when 2 clans are ready to fight or anything like that. So we were really kind of, we were saved by from our own people who, although they are from 2 different clans, they don't see us as trying to, take advantage or harm them. So even those, I mean, I can tell you Somalia was the easiest thing for me. Really. Because we knew everything what was coming. We had enough knowledge of the place and enough interaction with our people. Sometimes things happen at the very lowest level, like a vaccinator. If a vaccinator that's hired from another clan, either the clan would not take the vaccines, or sometimes in some refugee camps there was one shooting of vaccinated from another clan. But it could, it could have been managed, but we never had major fighting. And I don't know how to say it, but Somalia was the easiest thing for me.
I'm trying to decide what makes sense in talking with you about Somalia and South Sudan, and whether to talk about them separately, concurrently, because between 1999 and 2006, you also were working back in Yemen for a short period of time. You were working in Nigeria for a short period of time. I believe 2 other places as well.
You see, that's the reason I were able to do that is because we put a system that is so solid, and I was very lucky to have Atelia Christie with me in the last 4 years that maintains the technical integrity of the program. But we put a system that was so solid that it did not require me there to be all the time. The leadership. I mean, from putting aside the leadership, I don't know how to say it. Leadership is being able to make people to do the best in their work. I mean, that's it. It's not management is another issue, but leadership. And we really had a very, very, very good leadership that is interacting with the staff from top to bottom, but tough also on work. And everybody was really feeling that they are part of a major work that, so you cannot replace that, Sometimes you see, I just met her in Nairobi when I was there. One of my staff in South Sudan, she had acute appendicitis, and we medevaced her and to Nairobi, and her children were there, and she was not saying anything with the children. All she was saying is the micro-planning process. I am in this place, and let's make sure this happens. I mean, she is being pulled into an operation room, but all she knows was to talk about where her micro-planning is. I mean, you can't get that kind of enthusiasm, really. I mean, that is, the enthusiasm also is not just for the sake of nothing, but I think the enthusiasm is with the fact that everybody knew that where we were going and what was our goal. And if you have an army of people like that, it is really something that you can't stop. And there was no problems with vaccine acceptance. It's just making sure that technically everybody is well trained. I mean, according to wherever they are, whether they are vaccinators or surveillance or immunization, and we have a very simple way of really following up of what we are doing, and we were very supportive. For example, let's say I'm talking about leadership now. Let's say we rent a car from someone which from the very beginning, he knows that he is private car rental. In the car, you have a national person, a national polio work, and then we have an international polio staff. Let's say there is an accident. When there is an accident, what you can get from the UN rule is just to take the international one out, or even the national. But you have nothing to do with they tell you have nothing to do with the driver. No, with us, we charter the plane, go pick up the driver also, who we have nothing with, and take them out to neighboring countries' hospitals. So that kind of consideration that we give and to work with, really, open up more or gives us acceptance. So what we say is really not, and we made sure that we also not after numbers, just simple numbers. Because let's say we have a plan that says one vaccinators have to vaccinate 230 children, and then whether knowingly or unknowingly, because it was in the plan, you may see that everybody rise to 230, or something like that. So that we said, okay, guys, just to show you that we don't need the numbers, we need the actual numbers. We just don't need numbers. We said, okay, for the next 3 rounds, there is no tally sheet. Just go out and do it. And then they understand it's not the numbers, it is the fact that at least they are going out and reaching children, But in the institution of having, again, I go back with the fact that we were allowed to put together a very strong program in all essence, whether we need security officer, surveillance officer, and being able to lead it at a place that we know the culture very well and we know the subject matter very well.
Success.
Exactly.
What about other parts of the program that you had to develop? Were there parts that were especially innovative?
I think the first one, for Somalia was really to bring WHO and UNICEF together. Before I go, they just to show who is doing what. The payment will happen, and insist that we should happen UNICEF compound, WHO. Anyway, there's this WHO UNICEF thing is always there. But when I went, with the relationship with the heads of the agencies, board heads of the agencies, what we did was we eliminated this WHO UNICEF thing. Everybody is polio. So in one region, if the UNICEF office hub is stronger, then everything will be under UNICEF. So even to the extent that if a WHO technical officer or epidemiologist is working there, he will have the right to sign on UNICEF's financial document. Leave alone just so it was really, really fantastic, because there was no, they just, and I could do that because I didn't come from WHO, I didn't come from UNICEF, I came from, that's number one. The second one is really working with the NGOs, that, how to expand partnership. And that also, as long as you don't do things for the sake of, to, wave your flag and you just be humble and just find ways of doing things, NGOs and other partners, they don't want to be, called in just to help when the campaign is there. If you include them in the planning from the get-go, explain to them everything that you do, really, there's no big deal. So everybody in Somalia, every NGO in South Sudan, we were working hand in hand.
When you share information up front, like transparency, I think is coming up.
Absolutely.
In this interview, what?
No, like when I went to Somalia, the first thing I did was I pasted how much we pay for vaccinators on the wall, so that no one can keep something for himself. Everybody knows. So we said, no, put it on the wall. Put the name of the vaccinators on the wall, how much they get paid. So transparency is really the basics. You shouldn't try to. We should never try to really make people falsely feel good or have an agenda behind. No, whatever it is, if we are doing good, tell us. If you're doing bad, we tell you. But if you are doing bad, also we will tell you too. So we had no problem of being vocal and aggressive too. I mean, that's the beauty of my, especially my management. You know, some people, they see me like a little rough in the daytime, but you know, it's just tough love. You know, tough love, because we just want to, you know, things to be right. And a lot of my staff now, you know, they became so used to that, you know, just to say the truth, to do whatever you have to do, and move on. You know, we used to have a lot of problems with some of the WHO representative also, because we were just straightforward. We tell them what needs to be done. If they don't do it, we shout.
Could you give an example of that?
Always, you know, the representatives, they also have other issues that they need to deal with.
Polio is not the priority necessarily.
Maybe, you know, I mean, they have other issues. But for us, with the fact that we had timeline that we need to, you know, I used to say there is 3 ways to do polio, and among them I like the third one, the right way, the wrong way, and polio way. So whatever we need to do, whether it is right or wrong, you know, and we used to push that a lot, and we had a big support from the regional director on that. You know, so sometimes the interest of the regional of polio may not match with the interest of whether it is UNICEF or WHO program. And when that fight gets hot, then usually I was lucky that the system usually used to side with me, with polio. So whenever we have this kind of conflict with the WRs, the RD interferes and says, you know, because he knows also, you know, we have, you know, we are very open. Well, you know, our plan is really, you know, top notch. Our effort has no fault, so he cannot, you know, he knows how we work, so he always side with us and remove that bump or hump or whatever you call it from the system. So that's good. That was very good.
So working in partnership that way, could you talk about some of the ways you worked in partnership with the other NGOs and how that was different from UNICEF and WHO?
Yeah, I mean, the UNICEF and WHO, because we are the main implementing partners. But the other NGOs like MSF, you know, all of you know, Carter Center and all of these, you know, we went there and we are telling them now, you know, while they were doing their own things, we are telling them now, okay, here we are. Our program is superly important. You need to accept it. And each of them may be doing different things, but we are telling them from east to west and north to south, everywhere they are, you know, whatever they are, you know, say, you know, when the campaign comes, please drop everything and do this. And so what we did was, you know, we worked it out, because everybody's, in all NGOs, they used to have their center was in Nairobi, both for South Sudan and Somalia. So we present our case at the Nairobi level. And when we get, I mean, not only individually, actually, we do it individually, and then we call in a big meeting with everybody. And then from then on, once that is, you know, that is cemented, then all of our staff in the field will start really seriously working with their local counterparts. So it's not like, you know, either the local you know, counterparts agree and the central doesn't agree, but, you know, sometimes we even go all the way to the headquarters in their capital cities. So and of course, you know, like a place in South Sudan, everybody was in one big camp. It's called Lokichokio. So we all were there, you know. It's so it was very simple to really bring people together and explain to them what we need. You know, the last case of South Sudan, we were sitting at night, in Lokichogio with an NGO that their main role is whenever there is a war, active war, to go and evacuate injured population. So they know they don't have any place that they really sit, because wherever the war is, and then they don't have much time, land, take the persons, the injured, and then take off. So, at night, one night, we just said, look, you guys are going so many places, places that we may not even go. And can you help us in the surveillance? They say, what do we have to do? I say, just when you land, while you are, putting the patients in, just ask people, is there any paralysis child in the area? If they say no, just get up and go back, no problem. And then the first time they did, they say somebody told them yes. So we told them, okay, then if it is yes, just please take stool sample. And we never gave them what they collect stool sample. They collected it with matchbox. They brought it in, and then it was positive. If we had not worked with them, we would never have known that case was there.
And I guess did you have any objections to their collection method?
No, it's whatever they could do, bring it. But so this, if you go, so this is how we used to do. There was a lot of interpersonal relationship, not only with me but with all of our staff. Most of our staff, my international staff, were coming from MSF, because those are the ones who have worked in those areas before and have the stamina of working there. So I never had anybody who, almost all of them, they are from MSF.
I'm always curious about outliers. Did anyone ever arrive who was particularly green?
They won't survive.
Not in the first place.
They won't survive. Mm-hmm. They won't survive. We had a very tough system. Not tough as a system, but a tough team that, in each side, no one will allow you to. It's not that no one will allow you, but you just can't survive it.
Could you tell some stories about the tough team?
No, but what I said about the polio way is one of them. But I think it's really I don't know. A lot of them may say it is not, but I also don't think it is tough. But like if, let's say, if somebody has to move from place to place and per diem is not paid, or there's no, I go get money from my own bank and say, okay, now here you go, and then I go to the finance and administration guys and I say, okay, give me my money now. I just sent the guy out. Those kind of things.
I remember in the pre-interview when we sat down in your office, we talked a little bit about making sure people were paid.
Yeah, that's very important. Very important.
Maybe you could talk about that a bit, how you made sure, what the processes were, where those processes sometimes deviated from standard processes.
But the funny thing is payment in these two places. The smoothest payment mechanism in the world for polio was in Somalia. There was this, it is like, they call it hawala, or I don't know, there's this banking system that they have. There is no bank. It's all clan-based. Just if you give them a name in a village, in 2 days, and then in 2 days they will bring you back the real receipt that person has been paid. I mean, it was amazing. You know, it's I think after the 9/11, they've been, you know, because it's not an open bank and it's not, you know, but you know, it's called the Habshir is a Hawala system where we had no problem. I mean, you know, we give them $2 million and then in 7 days we had all of our receipt back. That's Somalia. In South Sudan, it was very difficult because in South Sudan, most of the places they did not even know what money was. So when we started the campaign, which Anthony was also part of it, we had to pay either in sugar, soap, you know, something like this, because nobody knew what they did not know what to do with the notes. So the problem was how to ship all this, you know, for $1, even for $1, if, you know, when you think about it, what you have to pay for the plane, it becomes like $5 because, so that was a challenge. At the end, eventually, you know, as time went by, when after the liberation, we went out before the liberation, but you know, carrying money like in sacks and you know, from planes, and but nothing bad had happened, you know, knock on woods. So we really made sure that payment to these people is for the vaccination is important. In Somalia, if you don't pay, you can't survive anyway, so they will kill you anyway. So, but the other thing, the good thing that happened out of what happened, you know, what happened was the Bob Keegan Polio Heroes Fund. It started in Sudan, in Somalia, because we had few vaccinators that were eaten by crocodile, or not eaten, but injured. So now these are people who are going out to do polio, but if something happens to them, there is, you know, we cannot just leave them, you know, on their own. So that's when we started the Polio Heroes Fund, which is still very active.
Medical expenses, education?
No, we pay a certain amount of money, and although it may not be something that will sustain them for their life, but at least, you know, so that also started there.
I'm going to take a look at the time. It is 2:33, which is great. We have some time left. We've covered surveillance. I'm looking at my topics list. I have a note here to ask you about Anne Renee Henningberg and Carl Tinstman, which really is a bigger question about who you worked with most closely, and if you wanted to give stories, tell stories about anybody that you worked with in particular.
Carl Tinstman. I think I told you, you know, the last time.
There is a Carl Tinstman story.
He was the representative in Yemen. So I went to him and he told me that I was crazy, thinking that we will do campaign cover under fives in 3 days, and almost kicked me out of his office. When he saw that we could do that, right after that, he was transferred to Nairobi to be the head of the whole UN consortium. You know, there is, you know, Operation Life Sudan. So when he left Yemen, he asked me, what should I do? I told him, start polio activities. I told him he'd be, you know. And he almost tried to slap me, because that was, the country was in the middle of famine. Anyway, he went, and then he called Bob Keegan, and he says, I'm Carl Tinstman, I'm the head of OLS. Bob was surprised. He said, what can I do for you? He said, I want to start polio eradication program. Bob almost fainted, because, you know, no one would ever think that would happen, you know, especially the head of OLS to come and say. But he said, but the only way I will do it is if you give me Elias. And then Bob said, well, I cannot give you Elias, but I can send you somebody who could be like Elias. And so he sent Andrane for a few weeks. But she came out after 9 months. So Carl is, as a leader of UN agency, that have really started that program. And since then, he has been just full-time working on polio. Now he is retired. And Andrane is, she spent there for 9 months. And then I remember right before, we had about 3 or 4 or 5 WHO consultants who were helping Andrane. And then they all came out and they said, you guys must be crazy if you want to do polio in South Sudan. So I went down and we agreed. We called the regional office and we say, okay, now take them out of here. They're not helpful, Yeah. No, Carl has been really a serious eradicator after that.
Talked some about partnership and also, partnership, especially between WHO and UNICEF. I'm looking at your CV, and one of the functions that you mention as part of your job as a medical officer and the coordinator for polio eradication and EPI is, you say, you coordinated cross-border activities among different regions of WHO and UNICEF to harmonize polio eradication activities. Could you talk about what you did and what you mean in your CV about by harmonize?
Yeah, because WHO has different regions, Africa region and Eastern Mediterranean region. In Horn of Africa, Somalia, Djibouti, Sudan is in EMRO, but Ethiopia, Kenya, all the rest is with EFRO. And then when you look at both countries, whether it's Sudan or South Sudan, Sudan and Somalia, the population is almost the same. So you cannot do one and leave the other one. So so since these two countries are from, or these countries are from two different regions, we had to come up with a very similar approach across the board. Whether it doesn't matter which region you are in, and so it was very interesting. Like in South Sudan, we used to bring northern and southern Sudanese, and they sit and they map where truly, without considering any militaristic implication of what they are saying, but they're really sitting and say, okay, here we cannot go, here you can go, and map them by hand, and it was good. And still, I think, like you look into Pakistan-Afghanistan border, you cannot separate the two. The Horn of Africa, wherever the Somali population lives, you cannot separate it. Kenya, Ethiopia, Somalia. So unfortunately, they are in two different regions, and we had to bring them together. And it was a regular discussion, not only at the technical level, but also at ministerial level sometimes. Yeah, that's very important.
Since we have a whole hour left, I wonder if it makes sense. Is there anything else you would want that needs to be included about Sudan and Somalia in terms of setting up a Ministry of Health in a way?
What we knew and what we know is that, some of the things that we change, how WHO itself operates. In the last time, if you remember in Yemen, I was talking only about me being there as a technical advisor to the ministry. And all WHO activities were always like that, technical advisor to the ministry. Here, we were not technical advisors. So here we started implementing programs. So we were not sitting as a medical officer or an epidemiologist, but we had to be thinking about, the finance and administration, the human resource. I mean, as a program, which WHO has never done that before. What we always did was it was taking the technical organization, so supporting ministries of health. But we shattered. I mean, we are the first ones that really started to do that because of these two. And then DRC came after us, and so that is another thing, which is separate from how WHO used to work. And I mentioned to you about how we used security officers, and I think a lot of things, like for example, what happened in Ebola response. Almost everybody that they had to use, that they needed for management, human resource, HR issues, financing issues, they were all from Polio program. That we used because we expanded the engagement of WHO from just being, a technical agency to be an operational agency. UNICEF used to do that before. It's no, big deal, but. That's another thing, and for that, it's you're not just a medical officer, but you have to be a politician. You have to be everything,
I asked Hamid Jaffrey about what he would ask you, and he had, he had said, well, I would ask him about the way he set this organizational structure up. And he also said that he would joke with you, or maybe you were joking, if I'm remembering correctly, about different titles within this organizational structure that you've set up or that you had set up. Could you kind of share what that joke was about, or some of the titles that you would make up? How did you think about that stuff? How did you figure it out?
I don't remember, but I know that he used to joke with me by saying he used to call these places Durry land. But I don't know. I'm not really sure what titles. I mean, I don't know if he has given you a little hint. I may take
That's
it from
all that
me.
he said. Yeah.
Yeah.
He didn't mention Durry land. That's pretty good.
Yeah, because he used to say, "Oh, these are Durry lands." No, I think it was the fact that he was in regional office was also very helpful, because and this is what we are missing these days. Us as a CDC to be in a very critical positions, managerial positions within WHO. We don't have that anymore, because that really helps to shape and influence because we don't have any of these things of, this is WHO, this is UNICEF, so we just do things because it needs to be done. And that's another thing. So it was really very, very helpful for, Hamid to be in Geneva, in Cairo, Bob and Steve, even Bruce Hayward. I was really very lucky. There was nothing that we proposed and it was not accepted. And again, because of the system that we put, I was able to also go out to other places. Like I went to Nigeria for almost 2 years when to lead the vaccination over there too. I mean, not to lead the program, but to bring back the program, because the program has been through a very tough time of, full rejection by the Muslim community in the north.
Could you talk about that, reinvigorating polio activities in Nigeria?
Yeah, I mean, it's one of dark time of a polio eradication where few people, not even religion, but few people can really derail what has been achieved. the fact that the northern community, Nigeria, I think I kept saying this so many times, it's really the community, everything has to be community-based. If you don't do it community-based, then others have a very good reason of blaming you of not doing the right thing. So it started with a simple argument, but then it reached to the level where not only the religious group, but the administrative structure, which is the governors, the cultural structure, which is the Amir, three major institutions, when they came out and they say, okay, we're not going to immunize, for sure nobody would be immunized. And that has taken, that had led to almost 23 countries to be reinfected because they stopped immunization. So, because of, well, it's a joke actually, but I went there to put the program back once the overall agreement, in a big way, after convincing them, taking them to Indonesia. But I was given the task of restarting the program. Again, that there is also the same way I look at things. What are the main issues? So how do we overcome those big problems? For 2-3 years, the population was really given this very strong opinion by, as I said, by three major community organizations. It was not easy to get the acceptance of vaccination very quickly. But again, there also, like I was doing in other places, we really put a system across the board that will be able to manage issues at the lowest level, but supporting it, all the way up, So, like what we've done in Pakistan, in Somalia and South Sudan, we really put WHO structure that is based on the, we were selecting who we sent where, and according to how what the culture is, the capacity and all, just to create that, again, that close community relationship. And it took a long time to bring it back, but there it was a little bit more rough and tough also. We had a national program manager who was really also very tough.
Who was that?
Durry Awashika. She was from military family, military herself.
Could you give an example of her toughness?
Oh, she couldn't care less about who you are. Governor, deputy governor. And when she stands and she wants things to be done, she makes sure. And she had a very good understanding of the program, and she also had, a big ear by the president. So she, but unfortunately she was from the south. But that's what brought the whole problems. There also, I think the stamina that we brought in, the enthusiasm that we brought in was, and the system that we put, this infrastructures are really very important. You cannot manage a place as big as Nigeria with all the problem that comes up with just having few people here and there. You have to have a very structured system that you have control on, and you can guide it, you can advise it, you can follow it up, but you just have to have, polio is not like a whack-a-mole. It has, when you do it, you got to do it across the board. Unfortunately, still, Nigeria is still struggling. But you don't know why you know, I didn't come out peacefully out of there. By the way.
What do you mean?
Hmm?
What do you mean?
I had to stand up with the minister, against the minister. This lady, Dr. Awashika, that I told you, she was not the most liked person by international NGOs and by or by the minister himself, because she was really tough, and there was some accusation that they had on her, and so they asked her, or the president was asked to remove her, and after a long back and forth, one day he removed her. So I went and I told him, you're making a mistake. And they brought her back. Because we were doing a measles campaign that could not be compromised. And nobody else could do it other than her. So when the minister knew I was the one who brought her back, well, actually, they didn't. I just didn't go back because Somalia also had a problem. But he was really not happy that I interfere in ministerial decision going to the president with nobody's permission.
Did you just walk up there and go in?
No, there was that week his wife died, and there was church ceremony for her. So I was just one of those who could get in. And we had 2 minutes to discuss, and I told him, you're making a mistake, and whatever they tell you is not right. At least leave her until the measles campaign is completed. Because for the first time, we were planning to immunize 56 million children with measles vaccine. Usually you do like 1 million, 2 million. And no one could pull that if it was not her. And at that time, the measles outbreak was so brutal, and he left her. So I was never told that I was not needed, but I told me, yeah, that was, but that, it was worthwhile because we could not have saved that many children without her. That's what I'm telling you. It's. And when I was asked, and I said, I know I should have, even the WHO asked me, how come we go to the president, I say, look, all of you think that you're my bosses. You're not. The bosses are the kids. I'm just reporting to you, but whatever they need to be saved, I will do it.
How did people respond to that?
Some thought I'm crazy, some thought I'm a hero, but Allah thought I'm crazy. No, I think this is not a work that, when we go, I've told you before, we go out to serve. When we serve, we are not, by what I mean by that is it is not for our, to our advantage. If I work in immunization and if I need to say that this is what I do for children, then the first people that I will be accountable for is those children who I said I serve. Everybody else in the middle, I don't know where they come from, what they want, and what is their agenda. But what I went for is to say, you can be anything you want in between. But at the end, what I do has really to be, really serving those communities or people that you say you serve. And I don't know where to buy lies. There's no, so I mean, you just tell it as it is and do what you have to do and move on. So, but with that really strong will to serve the children. And for that, you don't have to come up with, I mean, for that also you have to know what you need to do. Sometimes it may be right, sometimes it may be wrong. But most of the time, problems comes with this, this collateral damage that people who are doing something with you are bringing with them. So, that could be a president, that could be a minister too, Really.
Everyone makes mistakes.
Or everyone wants, has his own agenda, Yeah, and I don't mean you have to go out and really openly fight it, but when necessary. It's funny, I mean, this is a Pakistani issue, but, we had a big meeting in Pakistan with the chief minister sitting. Chief minister is like the governor. And with all the mayors sitting, and this is like debriefing of a big activity. And after they finished, he asked one of my staff, "What do you think? What do you have to say?" And then my staff says, somebody who worked with me for 20 years, more than 20 years, my staff said, "Yeah, Chief Minister, some people are not taking their job serious, or they're not doing what they are supposed to do. And for that reason, we run around, like up and down, and we do so many things that we should not have done." And then the chief minister says, he thought now Mohammadi is going to give him a name of one of the mayors. He say, who is this? And then my staff says, "It's you, sir." And you know what I mean? So we had that kind of, ways of saying it, but without being rude. But, and then he explained to him, like, if this is the first time you called us for this meeting, if you had done this before, all of us that we've been running to all the districts to convince the mayors would not have been done. So again, and then the chief minister said, okay, he pulled out his phone and said, "Give me your number." So he called the number and he said, "Call me when you need me." And then the staff says, "No, I don't want to call you. You now, and you from your own side come up with a way of following up. It's not I call you that, because it's then for me that we have to go, all these 30 districts to take care. So please take your responsibility." That's what I wanted to say. We were asking for that kind of, straightforward accountability.
Was that unlike the accountability that you, I'm assuming, required at other levels within the program?
Yeah, but sometimes we don't want to argue, or we say, or we have no problem to going to a governor. I mean, some people have problem even going to see an API manager. It's the attitude that you come in with. It's the only way that the API manager listens to you better is if he knows that you don't have to wait for, he doesn't put you on, on his waiting room and tells you, no. And I don't mean that you need to be above, but I think, polio also is not a Ministry of Health only initiative. You require all ministries to work. So, because it's really a huge program. It's not, Ministry of Health by itself cannot do it. You need Ministry of Religious Affairs, Ministry of Information, Ministry of... So to get all of those ministries to really be part of it, you can't just be with one ministry. So you have to go above. So that's why we go to governors and so on, So we actually raised that how can I say, who you work with. Usually we just work with the Minister of Health at the lowest level. No, that doesn't work. So, just to make sure that everything happens, so you need to go to appropriate level to make that happen. Because how do you bring all governors together? You need to go to the president. Because it is much easier once they are convinced and once they say they would take it on. I mean, in Nigeria we had governors meeting almost every month that is called by the president. Every month or every 3 months, I don't remember, but and the governor has to do the same thing there. And I think although it was still in the middle of suspicion of whether they're still convinced to immunize or not, but that's how we started. Now, that now it's even better.
So when you left Nigeria, that had happened after you had said, don't remove this person, right? And what then I immediately had to come back to Somalia also because there was importation of cases. That was end of 2015. Okay, end of 2015.
Somalia was in the middle of an importation outbreak.
So, but you left Horn of Africa and returned to Atlanta in July of 2006?
2005, I'm sorry.
Oh, okay, got it. Yeah, I got it. My chronology is off there. Yeah. What led to you returning here?
I've been there across all rules and regulations on how much somebody would be able to there, but for 10 years. Couldn't have stayed more. And I needed to come back to.
Is that because of the 5-year limits?
I was 10 years out.
Right, but
yeah.
Okay. Mm-hmm.
But I think it was good. Not there is no break, but just to come out of carrying on the shoulder big programs. I wanted to take a little bit of a break, but 2 years, and then I went out back again to South Sudan for a year, and then I went into this big Pakistan adventure, but no more.
Here now. Anne Renee Henningberg, we were brainstorming, looking at the list of interviewees for this project, and she said, she had a great idea. She said, I wonder if we should include children who had been out in country with their parents who were working. So I wanted to see if you have any stories about your children being in country with you.
I mean, they grew up with polio, so they know polio in and out like nothing, But they didn't like it. I mean, it's not they didn't like it. I mean, they're proud of what we do and everything. They were part of it, because every time I go, wherever I go, my home becomes the office. So they are friends with everybody. So everybody that, it's at the end of the day, whether it is on a daily basis or weekend, everybody comes home. So they have now a big family of my colleagues who we were working together all the time, and they keep in contact with them. But I think the one thing I remember is back when I was in Yemen, I don't know which year, they were small at that time, so I told them, okay, for the first time, I wanted to take them to Ethiopia. And then Sarah, I don't know how old she was, 8, 9 or something like that. And then she says, Daddy, is there polio in Ethiopia? I told her, I don't know, probably yes, of course there is. And then she says, no, she does not want to go anywhere for a vacation where there is polio. She thinks that if I go there, I will be also busy with working in polio. But I think they, I mean, probably I don't know what they feel, but I think they were okay with a lot of things that was happening around them, although it was so much for them. Of course, it gives them an opportunity to be different places. But with us specifically with me, because of that closeness with all of the other staff that I had, that we were close, they also had really a big family that they know. And it opened their eyes in a lot of ways. Even Sarah can tell you a lot, how now she's doing masters in development here at Emory. And sometimes, she gives examples of what she saw, what development means. Development is not just a science and a management. Development is really to understand exactly who you are working for, who you are serving, and how you're doing it, and all of these things. I mean, she really has now a very, very healthy thinking of what it means working in development. And that comes from seeing what we were doing.
And how you're doing it.
Yeah.
What are we missing? We can never get it all in 2 hours.
I think it's okay. What's the next one? Do you have anything more coming?
We have one more scheduled for a week from today, actually, same time, and that would be about Pakistan. Yeah. Does this make sense as a stopping point, you think?
Yeah.
Okay. Thank you.
You're welcome. You're welcome.
See you next week.
See you next week.